Hello friends, I'm Dr. Sanjay Pandey from the Department of Urology at the Kokilaben Ambani Hospital in Andheri, West in Mumbai. On this important occasion of Women's Day, which we celebrate on 8th March every year, it's time to come back to look at female urinary issues and overall female issues, which as a urologist, we take care of. So again, today on the World Women's Day, celebrating women's health and taking it forward to the next level for the amount of sacrifice, for the amount of in-depth work that they do for us, it's important for us to revisit the subject of female urinary issues in a big way. Friends, urinary issues do plague women at all age group. Youngsters, middle-aged, mature, elderly, and geriatric age group, at all age groups, women can go through urinary issues, which is many a times missed out. Missed out because either it is very progressive, missed out because the awareness in the public domain is missing, missed out because it's ignored, or it's treated by somebody who probably may not be able to treat and cure completely. Or unfortunately, the knowledge is missing on these subjects around. So ignorance is not a bliss in cases of women urinary health. The commonest problem which we look at mature women going through is incontinence of urine, where the urinary passage is not able to hold the urine back, which is otherwise a continent mechanism, a control mechanism. The bladder contracts and pushes urine out, the passage open and urine comes out. What has gone wrong that the woman is leaking urine or incontinence of urine? One incontinence of urine or leakage of urine happens when woman coughs, runs, jumps, laughs, and bends down for a prayers or bends down for normal work. So any kind of stress to the pelvic floor at the bottom, which is gradually undergoing a change because of pregnancy or pregnancies, because of hormone changes and menopause, because of age-related changes, this pelvic floor in women is a different one. And it can undergo a stress of compression of the abdominal wall or to the pelvis, which, as I said, because of running, laughing, jumping, coughing, bending down, and all this leads to a kind of disability, a kind of discomfort where you leak urine either in drops or the entire urine leaks out. Unfortunately, a progressive phenomena from a younger age group to a middle age group and to elderly women. Women suffer from this agony very silently, sometimes live in diapers. And friends, it's completely treatable. So if it's completely treatable, why do we miss out such an important phenomena where women can be treated and cured of an important aspect of life, which actually plagues their quality of life, called incontinence of urine. So overactive bladder is a different phenomenon. And stress incontinence, where not the mental stress, but the stress happening to the pelvic floor, which is either weakening post-pregnancy, which is weakening because of age, or which because of a female phenomena will be weaker than usual or whatever it was in younger age group, will actually leak out urine. And the urine can leakage be few drops to completely, and sadly that is plaguing a woman. So in her mature years of life, she is living on diapers, which is not the best way of living. So are we ready to leave incontinence, or we continue to live with incontinence on this wonderful celebratory day called the World Women's Day on 8th of March 2024? A very important aspect to take care to all of you. So if anybody is leaking urine because she coughs, runs, jumps, and leaks urine out, the treatment is available. No, not a treatment. Complete cure is available. You need not live on diapers. You need not get worried about coughing, running, jumping, or bending down for your namaz and for prayers, where we can cure you completely and get it sorted out. So as a urologist interested in urinary health of women, when women go through this problem, this was number one, the stress incontinence part, which is completely treatable and curable. The other aspect which I just mentioned is called overactive bladder. The bladder has to be relaxing. Don't forget that the bladder is something which lets you relax, sit into your meetings, into your travels, because the bladder is an organ which is a receptacle, which fills up gradually in the pelvis to a point in time where you control, and then you open your zip and the bladder controls and urine comes out. What if the bladder doesn't listen to you? What if the bladder becomes a master and you turn a slave? The bladder contracts erratically and makes you pass urine as and when the bladder decides. You could be in a train, you could be in a queue, you could be in a meeting, you could be probably in a classroom or could be teaching, and the bladder suddenly contracts and says, up to urine pass karna hai. And you have to go and pass urine out. And that is something not uncommon. So overactive bladder, where people have got increased frequency of urination, the bladder contracts erratically and makes you run again and again. Number two, you have got an urgency which is difficult to postpone. You keep searching toilets, mapping toilets in your location because you may have to rush when the bladder calls for its reaction. Or urge incontinence, where women suddenly leak out. That leak out is suddenly and is not related to cough. Cough leak was stress incontinence. When women leak urine, we do a small surgical procedure and the cough leakage goes away completely. Overactive bladder, The culprit is at the level of the bladder. So urinary bladder is contracting erratically. शैतान बच्चे की तरह बार बार कॉन्टैक्ट कर रहे हैं जब उसको शांत रहना चाहिए. And that contraction makes you run. The sensation is there. It sadly becomes a lifestyle phenomena. You go and pass urine again and again, something which you cannot hold urine out. Therefore, you stop drinking water, you drink less water, you search for toilets, you probably live in diapers, and the lifestyle is completely changed. Sadly, you are dehydrated, you're drinking less water. The urine is more concentrated, smells more acidic and more foul smelling. Sadly, you may land up with more infections. The hygiene part may be missing, or you may be wet in the undergarments all the time when you're wearing a diapers because it turns wet as a result of it and you don't know where to reach. Many times in this country and the world, women stop going to public washrooms, which is not a great idea because it is not the washroom which gives you a UTI, which is my next topic. The urinary tract infection, which sadly is more common in women, is only because of the kind of disposition which is in women's urinary passage. So friends, while we leave overactive bladder, which is completely treatable, if you have got increased frequency of urination, you're passing urine more frequently than you think should be there, or you have to rush. That's urgency you can't control. It's called precipitancy, and you would leak urine because of urge incontinence. Don't leave it alone. It is treatable and curable. Your life can change completely. In other words, a doctor assesses you completely by ultrasonography, by your urine routine reports, looks at there is no urinary infection. The bladder should not be erratically behaving. We silence the bladder and bring it to sane levels where your contraction becomes much better. Where you're able to control and go back to yesteryears when you were able to control, you could postpone urination, reach your washroom in time. As I said, women always feel that public washrooms are dirty, they smell a lot, they're not great places to go and empty urine. But what would you do if your house is 18, 20 kilometers away? If your place of work takes you at odd hours around, your bladder is too full at your workplace. So friends, it's not the toilet which gives you a UTI. Let's be very clear about this because a lot of myths have not been shattered on our channel and we have missed out many things. So today we shatter myths on Women's Day celebration, looking at that a urinary passage in women is made such. You have a urinary passage in women, and then you have the vagina, and then you have the motion passage of the rectum. The rectum has got bacteria which has no lock and key, and the rectal bacteria always come down there. The vaginal bacteria and the fungal also can come down there. Therefore, the introitus or the urinary passage of the women is surrounded by vaginal and the rectal bacteria, which actually contaminates that area. So, female urinary passage tip or the opening is sadly contaminated. It is more infested with bacteria which come from different rooms called the vagina and the rectum. And therefore, the hygiene demand is much higher than you would remember. We all take bath, we all feel clean, we maintain a hygiene, we use rewash and various other available products around, including soap and water. But let's not forget that bacteria soils that area all the time. Bacteria also soils the public toilet. But it's not the public toilet where a bacteria is waiting, where you go in, and it's waiting to jump into your urinary passage. Because the urinary passage tip is already soiled by vaginal and rectal bacteria, the bacteria can easily enter and cause infection, more so post-sexual activity, where you need to maintain a sexual hygiene, where you wash up, clean up, and empty your bladder before you go to sleep that night, which is called a sexual hygiene that many young women and middle-aged women need to maintain to prevent an infection post a coitus, post a sexual activity. On the other side, the bladder should empty completely. If it empties completely, you need to look at washing, cleaning up, and keeping that area dry, logically clean, changing your undergarments more frequently so don't develop a UTI. Sadly, gracefully, women age. And aging of women is not like men. Aging of women brings about changes in their hormone changes, which is a monthly cycle suddenly could stop one day at menopause. And when the monthly cycle stops, when we call it as a menopause, there are changes do happen in hormones entire body. Apart from the psychosomatic makeup and the changes in the body, there's a huge amount of change happening in the introitus or the urinary and the sexual passage. The vagina undergoes dryness. The dryness of vagina sometimes can bring about change in the glycogen level. The entire pH changes and the various kind of bacteria which come in replace the good bacteria which were commensal or your friends in that area. So what you have right now are different kind of bacteria which could be pathogenic bacteria which can cause infections. So women in their prime of life beyond menopause, our mothers and grandmothers age group could develop more infection. And therefore, elderly women deserve more help in terms of possibly hormone related therapies, which is called hormone replacement therapy, more hygiene. If there are diabetics, we need to maintain a diabetes good control, change of undergarments more frequently, and washing up and cleaning up, not have constipation. At the same time, look at that the urinary passage and the passage is not changing in terms of tightening, which could lead to changes around, and women can develop infections around. So infections happening to women can happen at all age groups. Young girl, college-going girl, recently married, middle-aged lady, elderly women, postmenopausal, geriatrics, anybody. The reason was because of urinary passage being soiled at the tip of it, because of the contamination, because of the anal verge being very close to urinary passage in women compared to anal verge being very far for men. And therefore, the contamination in men can only be because of the tip or the skin or the prepuce where men get UTI, if they at all get. So women get more urinary tract infection than men. And sadly, they continue giving a sample of urine, which is a wrong sample. Why do I say so? Because many women don't know that the right sample to give for a urinary tract infection to be assessed or picked up is a sample, not necessarily early morning, though preferably early morning, is a sample where you pass urine and the urine is a midstream and a clean cat specimen. So you clean your introitus and the vaginal area very well. Your bladder is already full. You start passing urine. First part of urine doesn't go to the bottle. Only middle part which comes out of your body comes to the bottle. Midstream clean cat specimen. Rewind and have a look at it. Middle part of urine, after having cleaned the lower part very well, the middle part only goes to the bottle without touching the bottle. A very important aspect which many of our colleagues would miss it out. As urologists, we are busy around when we miss out completely. Many women go to women or our friend gynecologists many a times who may be so busy with the work in the uterus, the vagina, and the various aspects of childbirth, they may miss out this important aspect of urinary health around. So for urinary health, please see your urologist in your cities. And the Urology Society of India has got urologists in every city who continue to work and pick up the causes of UTI in women. So a young woman in her 20s and 40s may have no major reason. But women who have got urethral blockage, women who have got lichen sclerosis changes, post-menopausal women and elderly women may have metal stenosis or tightening of the urinary passage, may have changes in the urinary passage. And all these can contribute to a urinary infection because the passage is not completely open as it was in yesteryears. The flow is not so good, and that can probably lead to this trouble. So friends, on this Women's Day, important for us to wake up that if we develop urinary tract infection again and again, which is called as recurrent UTI always has a cause. At the Kokilaben hospital, all the 6 days, working days of the week, I continue to see women at all age groups who have got recurrent urinary tract infection. We really find out the cause. We say we don't need to treat the smoke. We need to really quench the fire. We really need to know at the depth of it what the cause is in every woman, and causes could be different. So picking up a cause, treating them in time, preventing them from getting infection are important aspects of women's urinary health care at the Kokilaben hospital. We need to look into this with a lot of depth. Friends, I'm Dr. Sanjay Pandey speaking from the Department of Urology at the Kokilaben Hospital and continue to take this passion to very high levels in women who also have other issues. For example, as age changes, the urinary bladder may turn weaker. Its contraction power may be lesser. More so in people who have got spinal diseases, more so in women who have got diabetes of long standing, where when you do a sonography, you find that the urinary bladder wall has got thickened, where the urinary volume still stays and doesn't empty completely. More so in elderly population, more so in diabetics of long standing, where the urinary mechanism has gone wrong. The bladder's contraction power may be lesser. The urinary passage may get tighter. The meatus may get stenosed, all because of postmenopausal changes on the lower side, while the bladder may be weakening either because of age or because of long-standing diabetes, controlled or uncontrolled, or because of brain and spinal diseases, which can actually not let a urine empty completely. So some of the weak bladders, which are called hypocontractile bladder, may not empty the urine completely. Many of these women require urinary catheters. The large picture which I am talking about is women developing infections. We need to go to the bottom of it. So recurrent urinary tract infection is identifiable, treatable, and curable. So why wait? Why not get it completely sorted out? A very important aspect of care. While we're looking at this aspect of women's urinary health, we also know that the vagina friendly passage where uterus can sometimes prolapse, where if you're straining to pass motion, your constipated rectum can prolapse. All those things need to be safeguarded. These can happen more when somebody is straining and pushing. Somebody can be doing so more in the middle age and adult age group where things are tightening up, things are not in the right shape. Avoid constipation completely. Very important. Women are afraid of drinking water because they have to pass urine in public toilets. And I said, public toilets are not the seat of your infection. As a woman, your infection happens more frequently and more commonly because the hygiene demand of the lower urinary passage is more compared to men, compared to what you are in a younger age compared to middle age or elderly age group. Only because that area loses the hormone. So there's no guard outside. If there's no guard outside, anybody can walk in right now. So the bacteria which are waiting outside, coming out at the level of introitus from the vagina, from the rectum, can easily infect you. So friends, on this World Women's Day, while we celebrate women's health and take this glory to the highest level of being proud to be celebrating this day, it is important to identify women's health with a urologist. If you have a urinary complaints in your vicinity, please see your urologist. A urologist is qualified to pick up this and take you forward anywhere in India. They are going to look forward to everything. They're going to look at your midstream clean catch urine specimen if there's a UTI. If there's an overactive bladder, they look at a post-ward residue. They give you a good control, and weeks later or months later would do a uroflowmetry to know how good the flow is at your age group when the bladder was overactive. On the stress incontinence side, where because of multiple childbirths, because of pregnancy, because of the weakening of the pelvic floor as a result of age, hormone changes, the stress incontinence, not because of the bladder problem, but because of pelvic floor problem, can be treated and cured completely. So why miss out? There's no reason that any woman who hears this today would miss out this important aspect of care and cure, which can be done. I, for the last 15 years at the Kokilaben Hospital, have seen women from the Andheri region, from the entire Mumbai and Maharashtra region, and from women coming from country and across the country, and not only that, from abroad, who have known that some of their refractory conditions have not been treated. I also know that women also leak urine from the motion passage called the rectourethral fistula, which we repair. Women leak urine from the vagina, which is called a vesicovaginal fistula, which we repair and cure completely. Women leak from the ureter post any surgery or any radiotherapy, which again we repair and cure. So women's urinary issues are umpteen. Women's urinary issues sometimes are not spoken of. As I speak, I know that India does not live only in Bombay, Delhi, Kolkata, Madras, and Bangalore, but lives in smaller towns and cities too. And the reach to those women who live in different parts of the country and the world is extremely important for us, because we need to look at that women's health is safeguarded. An infection in a diabetic woman can catapult from the urinary bladder and urethra into the kidneys and can lead to something called as acute pyelonephritis. When women go through acute pyelonephritis as an infection, which actually can be very troublesome, which actually can be life-threatening. So all diabetic women who develop UTI, I would like to look at that we treat them and cure them and prevent them from infection. All women who get UTI get overboard with the kind of requirements that they have. UTIs. Sometimes UTIs are not picked up properly. Many times your urine sample is wrong and the doctor has only given you antibiotics to kill the bacteria, but has not picked up the cause. So the cause is picked up by that multidisciplinary work that we do in terms of identifying the cause. Whether it's a blockage in the urethra, or the bladder is too weak, or the hygiene is poor, or is it the sexual hygiene, or there is something else happening there which is causing UTI to you. So friends, women's urinary health on aspects of urinary tract infection, in terms of overactive bladder and not able to control urine, or in terms of stress incontinence, on this Women's Day needs to go to the very high levels around. It is important that women don't leak urine from any abnormal or normal passage. And this is what should be the motto of 2024, 8th March today, where we look at celebrating women's health to the highest possible level. Thank you so much.